Well, many area counties have been increased to a higher level of alert with the numbers of COVID cases continuing to rise. And with the holiday gatherings coming, we want you to be prepared. So we have our 9 News health expert, Dr. Kohli, joining us this morning. Dr. Kohli, thank you so much. There is a lot to keep up with when it comes to talking about all the different viruses that are out there. So let me just start with the most important questions that people need to know right now. What do we know about these variants, and are they more dangerous?
Yes, Jordan. So when it comes to COVID, we do have some new variants that we're dealing with. They're descendants of the BA.5. So remember BA.5 a few months ago was the dominant variant. Now we have these 2 new variants that are called immune escape variants because they are actually smarter than the BA.5. They're better at evading our immune system. But thankfully, we think they're still sort of behaving like Omicron because BA.5 is one of the Omicron variants. So they're not causing illness that's quite as severe. And we think hopefully the vaccine will offer some protection.
Oh, good. Okay, so some good news as we head into the holidays, because that's going to be something that's on a lot of people's mind. As you mentioned, that vaccine, that bivalent vaccine that a lot of people have been getting over this past year, is that going to protect us from these new variants?
So let me correct you. A lot of people have not been getting the bivalent.
Okay.
The numbers are telling us only 13% of eligible people have actually gone and gotten that bivalent booster. And I think that that's a real shame. Because when it comes to protection against these new variants and being able to enjoy our holidays, that's really our best bet. Moderna has released some data that says that, there's still a robust antibody response to these new variants, even though the vaccine was designed against BA.4 and 5. So not quite as robust as 4 and 5, but still there. But it's still protecting against hospitalization. So you may still get an infection, a breakthrough infection, but you're very unlikely to end up in the hospital if you get vaccinated.
Okay, that's wonderful. So on top of getting the vaccine, have these new variants changed the way we treat COVID?
They have, and that's what's a little bit of a wild card, because a lot of the antibody treatments that had been kind of our go-to, we were reaching to regularly, no longer work. Because these new variants, a part of the variant that the antibody targets has mutated and evolved away, so those antibody treatments are ineffective. Now, we still think that Paxlovid, which is the antiviral that you're supposed to take within a few days, we think that that'll still work. But to me, this is the biggest kind of scientific wild card when it comes to these new variants, is that if the next round of variants evolves such that our antiviral stops working, it's really back to the drawing board.
Oh, goodness. Okay, we don't want that to happen. Okay, so on top of the fact that we're talking about COVID, we also know this is flu season. So a lot of people like myself, let me say, a lot of people in my circle like myself, we got our, our vaccine and our flu shot at the same time. How effective is that flu shot kind of against this year's flu?
We're doing pretty good.
Oh, good.
Yeah. And so what we're seeing we're seeing a large number of cases. So we've already seen 13 million cases of flu across the country. And of those, we're seeing that most of them are influenza A, not as many influenza B cases. Now, remember, the flu shot this year had 4 strains. 2 of influenza A and 2 of influenza B. But the 2 influenza A's that we're seeing seem to line up pretty well with what we saw in the flu shot in terms of what's out in the community. And the CDC is estimating about a 50% reduction in severe illness or hospitalization, and that's pretty good.
We love when a doctor gives us good news. Absolutely.
It's not common, but I do sometimes.
I know, you can see your smile kind of spread across your face when you get to deliver that. One last question for you, because we did mention we are heading into the holidays. I mean, only 12 days away. No, I have not finished my shopping. Let's not talk about that just yet. But let's talk about the fact that a lot of families are going to be gathering, and people are going to be wondering, are there strategies I can be doing right now to protect me and my loved ones from this tripledemic?
Very much so. So first, I would say something you don't want to hear, which is it's time for the return of the mask.
Oh, okay.
Given the amount of respiratory viruses that we have circulating in the level, when you're in common public places, like when you're doing your Christmas shopping at the store, it's not a bad idea to put that mask on just to protect yourself so that you're less likely to get infected and, impair your travel plans in a few weeks. The second is, if you're the 13% that got vaccinated, great. But if you haven't yet gotten your COVID bivalent shot or your flu vaccine, it takes 2 weeks for that protection to kick in, and we're only 12 days away from Christmas. So go out today and go and get vaccinated. And then the third, I would say, is a phrase that I'm sort of starting, which is called test to travel and gather. So if you're planning to travel or gather, whether it's holiday parties, whether it's Christmas dinner, anything else, test frequently, test often, especially on the day that you're planning to gather. Use those home tests so that you can keep yourself and your family members safe.
All right, perfect. Dr. Kohli, good advice as always. We appreciate you being with us this morning.